You've mentioned the importance of health span over just lifespan. How do you define that health span, and how does chiropractic care contribute to it?
Yeah, health span's a newer thought process within healthcare versus we used to measure lifespan, which was basically simply just the quantitative number of years you're alive. And now we realize that quality over quantity, we're not trying to get to 100 if we have 2 bad decades on the back end. We would prefer to be able to do what we want to do as long as we're alive, and then, unfortunately pass on. And so what we're trying to do is to let people know is that your health span is actually controllable. I mean, barring some unforeseen situation or some sort of major genetic thing that you have built into you, every single day, the choices you make affect how your body, how it ages and what you look like, 20, 30, 40 years from now. And, the biggest, the most eye-opening statement that I've seen is that heart attack you have in your 70s started in your 30s. And that's one of those things that we're really trying to educate our patients about, is that your choices today will either make your tomorrow better or worse. And it's the practice of epigenetics, meaning that we can affect our genes. We're not just dealt a hand of cards. And whatever choices that we make, we either express those genes positively or negatively. And with continued research, we know what shifts that life into the positive and what shifts it into the negative. And so obviously moderation, but the more positive you do, the better your health span is going to be, the longer your health span is going to be. And so what does that mean? That means in your 80s, maybe being able to continue to walk or play golf or play tennis or travel or take care of your grandkids or whatever that means, versus having that decade of your life where you're constantly just in and out of doctor's offices, in and out of the hospital, just struggling to get by. How does chiropractic play into that? Well, the human body is meant to move. We know once you lose mobility, then your body starts to rapidly deteriorate. That comes from a circulation, that comes from nervous system. It comes from just an overall well-being where your body, your brain wants to move, it wants to be active. And we all know the horse world, where a horse goes lame and then unfortunately that's their demise and that's their rapid deterioration. And the same thing happens in the human body. It's just a little slower process. But think about somebody that's no longer moving, and are they vibrant? Are they mentally, cognitively where they want to be, or are you watching them decline sitting in the recliner? And it's a really terrible thing, and we obviously want to avoid that the best way we can, and that starts early, and that starts with prevention. That's not with the treatment of symptoms. That's with truly in reinstalling normal function to the human body, whether that's musculoskeletally or whether that's an organ or whatever that may be. And so we want people to understand that your life for the most part is controllable. And even if you're in a bad spot, they've shown that there's still neuroplasticity well into your 90s, meaning that your brain is still rewiring itself even in your 90s. So regardless of what phase of life you're in, you can continue to make tomorrow better or slow that regression.